Okay, started. Hello.
Hi,
Hi. Hello, I'm Dr. Prajakta, one of the doctor in the antenatal clinic today. May I confirm your name and age, please?
I'm Jenny. I'm 32 years doctor.
Jenny, the midwife has brought your case details, your blood reports, and she has asked me to discuss the reports with you. But my consultant is away. Will it be okay?
Okay, doctor, fine.
Yeah, and are you aware about the reports?
No,
Do you have any concerns from today's
I
consultation?
yeah, doctor. I don't know. I was very low risk pregnancy, and midwife told to meet the consultant immediately, and all that is only scaring me, doctor. And also I'm worried, whether I'm almost 11 weeks pregnant, and my sister's baby is having Down syndrome and suffering. So I'm thinking so much beyond.
Yeah, so your worries are, I will acknowledge your worries. We'll address one by one all those worries. Will it be okay if I ask you a few questions?
Yeah, doctor, fine.
Okay, can you just tell me in detail about your pregnancy?
Yeah, doctor, I am 11 weeks pregnant, and actually, we are not in a plan to for pregnancy, but we are happy to continue also because me and my partner were now we are in a stable relationship, and I'm taking folic acid, and my blood tests are done with you, and I am due for my scan.
Okay, during this consultation, I will be asking you a few sensitive questions and everything will be kept confidential. Will it be okay?
Okay, fine, doctor.
Yeah. Are you in a stable relationship as of now?
Yeah, at present, we are in a stable relationship only, doctor.
Any previous partner?
Yeah, I had one partner. We were together for 6 years, and during the time I was using OC pills.
Okay. And have you ever been tested for any sexually shared infection? You or your
No,
previous partner?
no, we are all perfectly fit, doctor.
Okay. Uh, what kind of contraception, apart from pills, you have used?
Yeah, after pills in between with current partner, we were using condom initially. Apart from nothing, doctor.
Okay. Do you smoke?
No,
Do you take alcohol?
previously, doctor, but now no. With this partner, I'm not drinking, and I stopped also because of
Okay.
pregnancy.
That's good. Any IV drugs or any uh, drug abuse? Have you used any drugs?
Oh
For
no,
fun?
doctor. No, I'm perfectly fine. My
Any
partner also.
any history of blood transfusion?
No, doctor.
Okay. Any medical or surgical history for which you are seeing a GP?
No, doctor, nothing. Fine.
Okay. What do you do for living?
Uh, yeah, doctor, I'm working, and at present 2 years we are here in UK. We moved from Zimbabwe. I'm working in
Okay.
office. I'm fine, doctor. My partner is also fine.
Okay.
Supporting.
Are you comfortable with English?
Yeah, doctor. It's fine.
Okay. Do you have any other concerns apart from the previous concerns?
No, nothing,
Okay.
doctor.
So coming to the report discussion, I do have your reports with me, which are your reports by your name. The midwife has sent your blood test, some viral markers which has been tested through the blood. So the hemoglobin is normal, the platelets are also normal, blood group is O positive, and you are immune to this rubella, and you are also negative for syphilis.
Okay, doctor.
Yeah, but
Then
we do
why midwife has sent me here?
yes, we do have some concern with your other test, that is HIV.
Oh,
The HIV,
HIV.
yeah, the HIV test shows positive for IgG antibodies. That means you have been infected with HIV.
Oh,
I'm
how come,
sorry.
doctor?
I'm
How it
really
is a
sorry.
sexually shared infection, right?
Yeah, the sexually shared, it is one of the route of transmission of HIV is sexually shared. The other
Uh-huh.
routes are also there, like blood-borne or mother to baby, or sometimes through IV drugs also, IV needle, sharing needle. So these are the other routes from which one can get infection through of HIV.
Doctor, I told no I was perfectly fine, except I have two partners. Do you mean my partner is infected then? He gave me this infection, right?
Your concerns are totally valid. Your questions are totally valid. For that, we need to take a help of this partner notification system, and we need to trace the contacts from means means who has been infected by this virus, and
Oh,
that through that only we will come to know. For that, I need to refer you to the gum clinic.
okay. What will happen to my pregnancy, doctor? I'm so worried.
Okay, so now onward, your pregnancy will be considered as a high risk pregnancy because of this infection, and you will be cared in a multidisciplinary team where a physician expert in HIV, a gum physician, or a gum physician will be involved along with my consultant who will be expert in HIV cases. A community nurse or midwife will be involved who will be named for this only. A GP will be in a loop along with the counselor because we have seen patients with HIV are prone for depressions. So whenever you feel low, down, depressed, do not sit, take early help. Report us to very early. Okay.
Okay.
Yeah. So along with this team of experts, we will be sending your few baseline investigations which will test the resistance testing of the virus for the drugs.
Mhm.
Then, yeah, along with that, we will be also testing for other sexually transmitted infection like HCV, and few more extra blood tests will be done. Since you are 12 weeks now onward, apart from all routine blood test and dual NT scan, you will be also screened for Down syndrome as you are having a question or worry regarding that. This test will be a screening test, and depending upon the screen positive, whether it is a low risk or high risk, if it is low risk, there are very less chances that the baby is having Down syndrome. But if at all it will be a high risk pregnancy, high risk, then in that case you will be offered either a blood test to check for the probability of having baby with Down syndrome or a needle test, which will be discussed once the report of this Down screening test will be available with us. Am I right?
Okay, doctor.
Okay. Once this has been done from 16 weeks onward, or after the in as early as possible, you will be started on a combined antiretroviral treatment, which is a means which includes multiple tablets and also known as HART, that is highly active antiretroviral therapy. It is
Mm.
safe during pregnancy. The safest drugs will be given to you. You will be monitored with the help of liver function test, a CD4 count, that is an immune marker, and viral load for HIV, which will be done quite frequently during the pregnancy at an interval. At again,
Okay.
yeah, and the baby will be monitored serially, come in all together with the consultant and the midwifery care. And at 36 weeks on, we will discuss regarding your mode of delivery, depending upon the viral load. Okay.
Okay.
If the viral load is less than 50, then we can very safely go ahead with the vaginal birth. For that, you do not stop any of your medication. Continue compliance to this medication. Do not stop it on your own. Okay. If
Okay,
at
doc.
all, yeah, if at all the viral load is of concerns or any other risk factor will be there, then a planned cesarean section will be discussed with you by the team of expert at around 39 weeks of gestation. Uh, Along with this, a vaccination for hepatitis B will be offered to you and your baby also once the baby will be delivered. After the delivery, baby doctor will assess the baby's condition and then they will categorize baby into low, very low, or high risk categories. And patient baby will also be put on some medication post delivery. I'm really sorry to say all these things to you at a stage. Will it be okay to continue?
Yes, doctor.
In UK, as of now, we do not recommend breastfeeding in HIV patients because it
Oh,
totally minimizes the chances of getting this infection through breastfeeding. As of
okay.
now, the chances of baby getting infection through mother is very low, as low as less than 1%.
Oh, so, doctor, if I don't follow, then what are the chances of my baby getting infected?
It is very high. One out of four babies can get infected if you will not continue the medication and not follow the practices what we are. asking you today.
Okay.
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 Uh, Here onward, if you want if you want, we can discuss this with your partner, or you can also reveal yourself all these things to your partner.
Yeah, doctor. Lot to process. I'll think about it.
Yeah, if you want any help, we are there to help you out at any point of time.
Mm.
There is a patient group, support group also, that is Sterile Singh's support group, who are for the patients who are living with HIV. You can get support from those people also.
Okay, doctor.
Meanwhile, I will be documenting all your case in the documents, and healthcare personnel will be taking all personal protective measures to minimize the chances of them getting infected. At that point, do not feel judgmental.
Okay.
Okay. Thank you for sharing all the information with me. I will book an appointment with my consultant as early as possible and arrange all the basic and baseline investigation as early as possible and refer you to the MDT. Thank you.
Thank you.
Okay, last 20-second extra.
Yes, ma'am. Time is.
Okay. Yeah, time, because it's a very lengthy session.
Yeah.
So that's the reason you have to decide where exactly you want to
Yes, ma'am.
stop.
Even though you
Yeah,
talked short sentences, but till time.
yes. Yeah. It's a very big sentences, and you don't know which will be their star point or which they want you
Mm.
to say. So your protection, husband protection, and baby's protection, all those things should
Mom,
go
and we need to
first.
tell also double contraception, no, mom. Post thing.
Avoid
No.
sexual contact. As of now, avoid sexual contact.
Okay. Mm.
Okay. Or yes,
Awesome.
use, yeah, till the time everything is getting yeah.
Now,
So
okay.
avoid.
Mm.
Okay. And once, okay, no, 1 second, 1 minute extra. Okay, so almost 11 minutes the time taken by the task. Also, okay. So the introduction, you know that midwife has asked you to see the reports. Consultant absent, comfortable in English, because if she has said all the complete name, then it is okay. What's wrong? I wanted to know. Result discussion, that is BBN. Setting agenda. How is pregnancy planned? Unplanned. Her views. If it is unplanned, happy to continue. Booking blood test, ultrasonography, signposting and confidentiality is very important. Current previous partner, STI practices, protection, safe sex, and smear. I missed out on smear here.
Yes,
Okay.
mom.
Medical, surgical, allergy, alcohol, IV drugs, support. Domestic violence, very important. Okay, because these patients are at risk of domestic violence also.
Mm.
Huh? And BT, this is another important question.
Mm.
BMI, you can skip. I will not say family history of concerns, because you mentioned. So that apart from that family history, it is nothing to worry.
Mm.
Okay.
Mm.
Explain all report followed by HIV. Always normal first, then abnormal. You didn't check my background knowledge. Okay, when you explained to me.
Mm. Yes, ma'am.
Yeah, so always check what whether she is aware. Explain all blood tests one by one, followed by HIV report. That means HIV, it's a viral infection. How it gets spread? If she's saying STI, do not say that it's the only route. You explain her there are other routes also. Bloodborne, it is bloodborne, mother to baby, and the other is IV drugs. Okay, so as of now, it is very sensitive and very difficult to answer that question whether I got it from my partner. So
Mm.
for that, we will be finding out by partner notification system, and we'll see whether means we are not in a, we cannot say that also. Yes, we need to find it out how you got this infection. For that, I will be referring you to the partner notification system of Glum Clinic, and they will be notify all your previous partner, and then they will without your telling your name. Okay, and then at least we will come to know. Along with that, you need to tell your partner also. If you want any help, we are there to help you out. Till that time, avoid sexual intercourse, use practice safe sex. Okay. That is here only you can explain all those things, and referring you to a gum clinic. So implication of this infection, yes, it affects your immunity and you are more prone for infection because this virus affect the immune system. But treatable nowadays, it is treatable with this highly active antiretroviral treatment, and it needs, but we need to continue this treatment lifelong, and it is known as combination of ART. Okay, as baby crosses the as this infection crosses the placenta, that's the reason we need to start this ART as early as possible from second trimester. But by 24 weeks we need to start you on this. Okay, so pregnancy will be considered as high risk. MDT, HIV physician, OBGY specialist, midwife, GP, gum clinic counselor, very important. Okay, gum clinic counselor will be a part of. Regarding risk of down, we can do a quadruple marker including NT and blood test which give us a low risk and high risk. Depending upon the further screening, we will be offered either invasive testing with coverage of CART, okay, if needed. That means if she being positive for HIV doesn't minimize it, will not we will still we will offer her needle testing at that time, but we will discuss how we will be offering her. Okay, so other now how her antenatal care will be apart from routine test and serial growth monitoring of the baby. The management will be, we need to see the resistance of viral testing, to start CART as CRT as early as possible, not beyond 24 weeks. She can continue CRT once started, or she can stop post delivery as per her choices. Okay, that will be decided by her and HIV physician. The full blood count, sugar, liver function test needs to be done on CRT regularly. You do not need to tell when you want to say this. You just need to tell her that okay, we will be monitoring you for this.
Yes, ma'am.
HCV, it needs to be screened. Additional screening will be for HCV. Vaccination for her and her baby for HBsAg antigen once the baby will be born. Baseline CD4 count and at delivery or 36 weeks. And viral load also will be routinely checked upon. And again at 36 weeks we will be seeing, and depending upon that we will be aiming for vaginal delivery if the viral load is less than 50. Otherwise we will discuss the alternative mode of delivery, that is cesarean section. Okay, if there are any concerns, if you want to keep your sentences very short. Baby doctor will assess baby after the delivery and categorized it into low, very low, and high risk. And depending upon that, they will be started on the CART prevention and vaccination. Okay. B. Breastfeed formula filled is recommended as chances of infection is negligible through breast milk. Baby doctor will be screening for the screen baby for the infection depending upon the risk. The last testing will be at 18 months. Yes.
18 months, ma'am.
Yeah, with all these modalities, the chances of baby getting the infection is very, very low as 1 to 0.1%. Okay, there are different concerns of this patient. So one of the concern the patient may say, I want to breastfeed the baby. What is your
Mm.
say? If you want to say breastfeed the baby, then yes, we will be respecting your wishes.
Wishes. Mm.
Yeah, and you will be monitored for this virus, and you and your baby will be monitored for this infection and viral load frequently. Okay, frequently.
Mm.
That's it. Only clinical
Baby
monitoring.
only will be monitored, ma'am. When she wants to breastfeed,
Yeah,
baby,
yeah.
that protocol is different for breastfeeding babies.
Yeah, so do not say that. What is the role of water birth? Can we offer her water birth?
If the viral load is less than 50 and she comes to fit the criteria for vaginal delivery, we can offer water birth.
Yeah, so that might be another the other concerns the patient might be having. Okay, we encourage you to disclose this news to your partner. If you need help, we are there to help support you to disclose this. Avoid sex, blood transfusion lifelong. She cannot donate her blood. Okay,
Mm.
till complete investigation is done. Use condom regularly here onwards. Okay. Since it's transmitted with blood and body fluids, healthcare worker will take precautions to minimize transmission by by wearing personal protective wears, and it will be documented in your case details. Do not feel judgmental. It is important patient safety measures to avoid cross infection. Okay, shall I give patient information leaflet of HIV in pregnancy? Support group is Terence Singhi's Trust Living Well with HIV. MDT, I will be starting MDT formulation, blood test, counseling will be arranged. Now, seeing a domain-wise scoring, this is one of the very big station. The scoring is also very high. So the relevant history will be regarding her pregnancy, regarding her review, ultrasonography, and social history. Okay, family history is important. Partner history is very important. Current partner, previous partner, STI history. Okay, drug abuse history, blood transfusion history. Then family history of Down syndrome is important here. Hmm? Previous partner, this is previous partner history is also very important because the history partner had multiple broke relative relationships. History of previous recreational drugs, none. Obtain information about drug and history and allergy, none. Sexual history, no previous history of STI, number of sexual partner and contraception you mentioned. Appropriate investigation, that is viral load, CD4, liver function test, screening for STI including HCV, ART resistance of viruses and FBS. Okay. Initiate investigations for aneuploidy. Okay, that we had discussed. So that is all about information gathering. BBN, it is very important, BBN, but do not ask someone to be with the patient. It is something, her HIV report is not normal. It shows the immune antibodies to this HIV infection. That means she is being infected for this. Okay, discuss implication of test, need for confirmation, further investigation. What next? Ask to inform the partner. It is another important point. Counselor regarding commencing of CART, that is antiretroviral therapy, but depending upon the viral load and CD4 count. Best to start before 16 weeks, but we need to start by 24 weeks. Always remember that. Less than 50, normal delivery. If the viral load count is less than 50, then normal delivery can be offered. Inform patient that the greatest risk is vertical transmission during birth and post delivery. Okay, so post delivery, that means through breastfeeding also. Discuss management of baby requires neonatal ART duration, which will depend upon very low or moderate or high risk. Okay, so you do not need to go into that part. You just need to tell her that baby doctor will be
Mm,
deciding. Okay, baby doctor will be
okay.
deciding depending upon that. Do not say, and he will be screened, he will be vaccinated. Okay, at least take a name of baby doctor. At least, okay,
Mm,
you had uttered something, because this is a very lengthy session. If you are going to show all your knowledge, you might not be
mm.
completing the task. Okay, breastfeeding, as of now they are not recommending breastfeeding, they are recommending formula feed. Briefly mention neonatal screening for vertical transmission. Communication with colleague, consultant, multidisciplinary, GUM, HIV physician, specialist interest in HIV, specialist midwife, clinical psychologist. Neonatal, flagging in the notes. They had mentioned flagging, that means the case notes will be mentioning she is
Mm.
positive, so that the healthcare people who are involved will be aware about that. GP and community midwife is important, and contact tracing. Okay, for partner. Now, patient safety here is confirm whether there is any drug allergy. Institute CART appropriately describing the benefits of it. Appropriate vaccination for HBsAg vaccine. Okay, understanding when to inform partner and screen him. Counsel about sexual intercourse, use of condom until partner has been screened and found to be positive. Provide positive reinforcement that CART is now the almost associated with normal life. Somewhere somehow you can just need to tell her that this with this we are seeing that the patients will live with HIV living normal life. Hmm? Discuss the implication of HIV in pregnancy, impact of pregnancy on HIV, and vice versa. We do not have that much time. Discuss the
Mm.
management and need for MDT. Able to introduce prenatal screening, aneuploidy, and the difficulties in invasive testing required if the viral load is high. But even if it is a viral load, she can be offered all the options depending upon the viral load, include describing the pros and cons of all these options. Okay, that much we can discuss. Depending upon the viral load, she will be discuss pros and cons of both the options, invasive and non-invasive testing. No? At least you tell this much only. Okay. So, any question regarding this consultation, this topic?
Oh, it is a lengthy one. We need to practice, and to reduce the words.
Yeah, reduce the worth. Okay, but at least we had completed.
Like the apart from medical